Hi, everyone. I hope you're having a wonderful evening. I am so excited to be joined this evening by Jordan and Alyssa. If you remember and you've been following along, we had a great chat about a month ago about specifically intended parents and their role in the delivery room, all sorts of delivery room expectations, what it's going to be like to welcome your baby into the world, and kind of all the tips and tricks about that. So it's clearly a huge topic. And at the end of our part one last time, we decided immediately that there needed to be a part two because we didn't get to so much helpful information. So if you haven't seen part one, you can get yourself all caught up later. For the next 30 minutes or so, we're going to be live. And if you have any questions, comments, thoughts you'd like to throw out there to the group, please go ahead and feel free to put those in the chat from wherever you're watching. We'll be able to filter through those, and I can ask those live of our lovely guests, and we will jump right in. So my name's Hannah. I'm a communications specialist at Family Source Consultants. I was also a one-time surrogate, so I have been in the delivery room one time as a surrogate on that side of things. And I'm joined here with my experts. So Jordan, can you introduce yourself and tell us a little bit about your professional background and your role here at Family Source?
Sure. So my name is Jordan. I currently work with the match team. I'm also one of the nurses that helps collect a bunch of the records that we do for incoming surrogates. And then we help with the match team to help get profiles out and get match meetings coordinated. And then we do all the post-match steps. Professionally, before working at Family Source, I worked in labor and delivery as a postpartum nurse. I also did a handful of baby catching is what we called it. So I did more of focus to baby once baby's out versus the labor portions. I'm also a 3-time surrogate. So I'm currently on my 3rd journey. I'm about 19 weeks and just in love with all things surrogacy. So I'm an open book.
So good to have you here, Jordan. And Alyssa, can you tell us a little bit about your professional background and your role at Family Source?
Of course. So professionally, I've been a registered nurse for about 5 years. My background is in labor and delivery. I did recovery, postpartum, and then scrub nursing for all kinds of deliveries. I have personal experience with infertility, and that professional and personal background led me to wanting to do more, and it led me to FSE. And so my role is pretty much the exact same as Jordan's here, just that record collection and really helping surrogates through the matching process and following up with them at the end until they're ready to move forward with casework here.
Fantastic. Well, I'm so excited to pick both of your brains, having the experience, especially on kind of the medical team side of things. So let's jump right into talking about delivery day. So we talked a bit before in our last session about how to prepare for delivery, but let's say that folks are coming in from out of town. When should they show up in town? What is the plan for that sort of thing? How many appointments kind of show up leading up to delivery? What's going on kind of in those last couple days of the pregnancy?
I'm going to kind of chime in first, if that's okay. I'm going to share kind of both personal and what I see kind of professionally. So my first journey and my second journey were both with intended parents that were international. This led to a lot of when do we come in? What week do we need to be there? What appointments do we have? All those things. My first intended parents did actually miss the delivery, but they were supposed to fly in 3 days after we started induction because I was in pre-labor. So that's the reality is some intended parents internationally have a higher risk of missing the delivery. My second intended parent, I didn't do twins that time. I only did a singleton. He planned to be here at 37 and a half weeks. He got here. He went to my 39-week appointment with me. And he got to be there for the whole delivery process. I think that it was a little bit more prepared and less high risk for those other factors that play into your planning, because pregnancy, you can't really plan delivery unless you're a 39-week induction. It is more common professionally in this industry, as long as you've had full-term deliveries, that if a surrogate and the intended parents are okay with it, Scheduling an induction at 39 weeks is a possibility. I see that a high volume of times that people are willing to be induced, just to give that little bit of planning that they can trial for. I don't know if Alyssa wants to jump in after that.
No, I think that's great. I mean, I think that we see a lot of international intended parents plan to come in maybe 3 to 4 weeks before delivery if they have that option, or before baby's, intended to be here, just so that they hopefully don't miss the birth. But like Jordan said, pregnancy is so unpredictable, and so sometimes that doesn't happen. Same thing for even intended parents that are in the States. Sometimes they plan to come a few weeks before baby is set to arrive and be local to the surrogate, just in case she goes into labor early. But most surrogates are induced, like Jordan mentioned, and that does help with the planning. But sometimes things happen, and the surrogate may go into labor early. And so I think the plan for when the intended parents arrive to the hospital is really something that needs to be talked about ahead of time with the surrogate, with the intended parents. Are you someone that takes days to labor? Are you someone who generally has very fast labors? And so maybe you want to plan for those intended parents to be there as soon as possible. As soon as you feel that first labor contraction, you really want to get those intended parents on the fast track to the hospital. Or maybe you're somebody who labors for days and you're not as worried about them missing it, or needing to be there as soon. So I think just kind of knowing what the surrogate's history is, and just everyone being on the same page about what the plan is very helpful.
I completely agree. And I think it's nice to have plans going into it, but know that anything can happen. So I will say too about the induction, that's a great point. And I think it's something that should be brought up. Would you recommend even at the matching, really, if that's something that's important on either end to either the surrogate or the intended parents?
Yeah, I think that's an appropriate thing to bring up, and either if it's not already in your profile, or a match meeting, or having that conversation once you guys get introduced and have each other's information. Or another factor is like maybe you're completely uncomfortable with having that conversation at all. That's where you can reach out to your case coordinator, and your case coordinator can have that crucial conversation with those intended parents that you're working with. So kind of getting an idea, and then just maybe keeping you in the loop of what their responses were.
Yeah, I think that's also a great point, is that we have folks on staff. So it's not just you having to have that conversation with the surrogate right off the bat, right when you meet them. But these are topics, I think, especially around the delivery and what that should look like, that, the surrogate probably has some thoughts and opinions on what type of delivery, what that looks like for her. And so making sure that the intended parents, I think, are on the same page and comfortable with all of those things going into it, I think is important. Would you all agree with that? Is that how you've seen it work out in the past?
Yeah, absolutely. I think it's great to have that conversation as early as possible. I think that's a thing throughout what we're talking about, is just to make sure that as the surrogate, you're expressing those thoughts, even if it's simply, I would like a 39-week induction if it's offered to me. And for those intended parents to also chime in if that's maybe not something they're so comfortable with, or if they are on board with that. I think it's great to have those conversations as soon as possible.
Mm-hmm. So when you do get to the, it's either there's an induction, or let's say the surrogate just naturally goes into labor, then how does that start? Who calls who? Like, what are the logistics of getting to the hospital?
So I think that really depends on the kind of relationship that the intended parents and the surrogate have. Many times I think that those surrogates are quick to text or make those phone calls to the intended parents. Hey, I'm in labor. But that's where you also can rely on your case coordinator. Maybe you don't have as much of a close relationship with those intended parents, or maybe they're international and so they're sleeping. You're not able to get a hold of them, sort of thing. And so I think, really relying on that case coordinator, if that relationship is not there, you maybe don't have that texting relationship or that phone call relationship. But I think, really having those surrogates reach out to the intended parents first, try to make that initial contact, but also relying on your case coordinator, updating them when you're in labor. and they can help get a hold of those intended parents if you're having any trouble. They're a great resource. So I think letting the intended parents know and letting the case coordinator know is the best course of action. Just try to let both people be in the know as soon as possible.
10,000% agree. Personal experience wise, anytime that I went to labor and delivery, even if it was what would be the middle of the night or early morning for my intended parents, like I said, my first two were international. I would just say, hey, was feeling crampy, went to labor and delivery. We'll keep you posted if there's anything coming. I also would make it a text message or an email for my case coordinator to also be in the know, so they also knew whether it was eventful or not. But no, those are all great points. Just being mindful that if you are not necessarily comfortable saying, hey, I'm here, you can call your case coordinator, and they do typically give you their direct line in case of emergency, which, being in labor, I would consider that emergency for intended parents being able to be in the know. So
yeah, and Jordan, I think you bring up a really good point about every time the surrogate may go into labor and delivery, it might not be the time, right? So I know that happens so much more frequently than I thought it did before I had babies myself. Is that, something feels weird. Even this last time, my water broke for real, and I was still confused about whether or not I needed to go in. The phone call I made was like, I'm going in. I'm not totally sure. Just stay tuned. I'll keep you posted. Even though it was like very apparent what was going on, I was just in disbelief. So I think that sometimes it feels like it should be so cut and dry, like, yep, it's time. Let's all go. The end. But that's not always how it is, right?
Yeah. My first journey with the twins, I got 2 weeks in a row. I was at work. They took me off work. So it was my third weekend where I was like, they're just going to give me fluids and send me home. I'll keep you all posted. I sent my husband home because they wanted to keep me. Then I progressed a little bit overnight, and he was like, safety wise, now the baby's breached, we really should do this. And I was like, oh my gosh, if that's your decision, you have to call the parents with me.
Right, because you'd already told them something else. Yeah, it's kind of, again, as much as you plan for it, sometimes even in the moment, you got to just kind of roll with it. So for folks watching, again, just a reminder, if you put a comment in the chat or if you have a particular question, feel free to drop it in there and we can answer those live for about the next 20 minutes or so. But I want to talk about when you actually get to the hospital. So let's say it is an induction. How long do inductions typically take? What does that look like? Alyssa, this one's all you.
Yeah, it varies so much. And so it's a little bit of a challenging question to answer. But, most inductions can last anywhere from, we'll say, 12 hours to 48 plus hours. An induction is kind of making the body do something it might not quite be ready to do. And we talked about a lot of surrogates do plan to have inductions. The great thing is all surrogates have had babies before, and that definitely helps the induction process speed up for most surrogates. But it really can take a very varying time. It can be that quick 12 hours, her body really kicks it into gear, or it may take 48 hours or more. It really just is how prepared is her body when she comes in to have that induction, and how quick does she respond to that medication. And so, generally I would say within about 12 hours, you kind of know for the most part, is this going to be a quicker process or might this linger on a little bit? That's just a general thing. Of course, everything is different. We can only plan for what we can plan for. But typically about that 12-hour mark, you're like, okay, this might take a little while, or she's really starting to ramp up and get into gear, and this might be a quicker process.
Mm-hmm. And then Jordan, what would you say? So if it's going to be that 48 hours or longer, what do the intended parents do for that whole time? Like, what would you recommend? What is that? I know it can be a bit of a spectrum, but what should intended parents plan on doing that time?
This can kind of play a factor on how close you are. My intended parents for my first two journeys really wanted to be involved. My second journey specifically, my intended parent was with me in the hospital when we got there. Like we drove there together. He just wanted to be present for the whole process, whether that was painful or easy, or they brought their phones, they brought like crossword puzzles, they brought their whatever games they were into, knowing that it could be a day or two. When it comes to like that after 48 hour, again, depending on how close you are, this could give opportunity for like intended parents who want to be more hands-on with their surrogate if they're okay with it. Like, do you guys want to do counter pressures together? Can the nurse that's doing labor with you take the time to teach the intended parents how to, you know, give you counter pressure if your epidural's not working, or say you don't have an epidural at all? How can we help that surrogate control her pain levels to help her with dilation faster? I think one misunderstood portion of labor is that, yes, it's painful, but the more tense people get with their labor, it's decreasing that opportunity for dilation to occur. So kind of finding your zen in the pain, even though that's the biggest challenge and easier said than done, trying to find those people that are your proper support for the whole process can help you get through that. I mean, my husband's been present for all of my deliveries, but even on my own deliveries, my mom still just like knew my body better. So I think when you consider like being close with intended parents, I can envision like delivery with this one. I have my first traditional type couple. They're within the States. So I talked to my intended mom about, you know, would that be of interest to you? Like, do you want to be more hands-on involved with labor? And are you interested in learning counter pressures? So doing those things and just being present for any kind of decision making is really helpful to an experience for everybody. Typically after about 72 hours, though, that's when doctors typically start to go, are we really making progress? Are we halted more? Should we consider C-section? Like, what are all of our options depending on what stage you're at? You know, are you still at 3 centimeters and you've been there for 2 days? It's possible that maybe baby is either too big or they have like a nuchal cord that's preventing them from continuing and descending down the vaginal canal, like those kinds of things. So sometimes that can be something that comes up medically is, do we want to continue forward with a C-section, and having those risks talked about and involved with the intended parents.
Jordan, to back you up a sec, can you go into a bit further detail of just to define what counter pressure is? I know you were doing it with your hands, but to tell folks who might not know what that is.
So sometimes, like, depending on where your pain is. So if I give an example, my most recent delivery for my surrogate journey number 2, my epidural was only working on one side and I was getting really bad hip pain. And so my nurse came in and started pushing on my knees. And when you're pushing your knees in, it was decreasing the pressure and the pain that I was having in my hip. So because you're so tense here and trying to like breathe through it, having that pressure against what's hurting can actually relieve pain. I don't know if that makes sense. But there's all kinds of places that you can do counter pressures. There's even counter pressures like if you have somebody who's kind of on all fours or on their knees, and you can push on the back side of their hips if they're having pain more to one side or not. There's all kinds of ways that can go. Alyssa might know more about specific techniques for that, but those are just things that I experienced in the delivery room.
No, I think that's great. I think you covered it. If I think about a simple way to maybe describe it is like if you have a headache and you squeeze your head, and that helps for just a few minutes. Mm-hmm. When you have a really bad headache, to squeeze your head, kind of the same concept. I would see a lot of counter pressure in the lower back. So just, you know, holding that firm pressure where it's hurting can really relieve pain for surrogates or for patients in general, especially if babies maybe turned a little bit, not quite facing the right way. That can cause a lot of back pain. And so just putting that pressure against where that pain is, like Jordan mentioned, is really helpful for a lot of people.
Yeah. And somebody had asked, is counter pressure good to do even if you aren't in labor? I would say as a formerly pregnant person, yes. I know, it felt nice, right? I mean, Jordan, you're a currently pregnant person. It's kind of nice if somebody just like pushes on parts of your body that are kind of sore, right?
I mean, it's kind of like, I mean, being pregnant, I'm very prone to like ligament pain. And so in my opinion, a counter pressure is when you're like using your stability belt or K-tape to lift your belly, because you're taking these muscles that are being stretched like this and you're going whoop and pulling your belly up so that they're not being as like I pulled on, but they're not as tense because you're relieving that pressure. It's the same kind of concept. I feel like counter pressure is also good. It's not any different than like getting a massage on a spot that hurts, or getting in a car accident and seeing a chiropractor because you hurt something. Like they're going to help find counter pressures and give you techniques to help work those areas that are hurting. So I strongly think that even though we're talking about counter pressures in labor, it's still something that you could apply to pain in general and talk to your providers about.
Yeah. And I think that it's an easy thing that anybody can do. So I do go back to like, it definitely depends obviously on your relationship with, you know, the surrogate and intended parents, but you know, my partner was doing that with me in labor, and then sometimes the intended mom would step in and kind of make sure that I was being supported physically in the ways that I needed, and that was super, super helpful. So I also went on a lot of walks, so everybody was like taking a turn with me, making a lap around labor and delivery floor. So obviously that's not everybody's experience in labor, and if you have an epidural, a walk is not an option anymore. But for a while, I was definitely one of those 48-hour plusers where the beginning part, at least, it was a lot of circles. So I would walk with the intended father, and then we'd come back, and then I'd walk with my husband, and then we'd come back, and then intended mom and I would go for another lap. So there were definitely ways to keep everybody kind of involved and to keep me sane. And that is kind of the goal of everybody, I think, is keeping everybody just happy and healthy and moving along. So I love those ways for involvement. But on the flip side too, knowing that as an intended parent, you are not required to sit there and stare at the surrogate for like 3 days if that's how long labor is going to last. So what I think, like having a kind of contingency plan of like, we're going to go sit out in the waiting room, or there's a McDonald's down the street that we're going to go run to, I think might be some important conversations to have before labor as well.
For sure.
Definitely. My intended parents, when we first attempted to break water with my most recent, we didn't know what we were going to be doing. So they were like, we're going to go get breakfast. I'm like, take your time. We're clearly going to be here a while. So my husband and I did laps after we attempted to break water.
Yeah. And everything is a little different. So then with delivery, I know we talked a little bit about like actual delivery last time. We did not yet touch on like what happens after delivery. So immediately following delivery, Alyssa, can you kind of refresh us on like what are the options for where baby can physically go, even in like those first 30 seconds versus like the first couple minutes of the baby's life?
Absolutely. So, I think it's great to remember that baby is still attached to the umbilical cord right after birth. And so baby typically will go on the surrogate's abdomen or chest in those first few moments, just while they're waiting for that cord to stop pulsing and before they're cutting the cord. It can be a little difficult to hand baby off unless baby has a really long umbilical cord. So typically, the baby will go right up on the surrogate until that cord is cut. And then your options from there are to skin to skin with the baby as the intended parent. A lot of intended parents do choose to do that. They may have a hospital gown and be completely ready to take that baby as soon as the cord is cut. If that's not something that you're interested in as an intended parent, baby can stay with the surrogate, especially if you're maybe planning to have the surrogate latch the baby for breast milk pretty soon after delivery. That may be an option that some intended parents choose. Baby could also go straight to the baby warmer. Maybe those intended parents would prefer baby kind of be checked out and be in the warmer, and they're both able to come over and see baby really well and kind of separate from that surrogate in that moment while she has her privacy to help with recovery. So those are some of the main options that you can choose. I think it's just really remembering that those few initial moments before that cord is cut, baby may have to be with surrogate, but then you really kind of have any options that you would like. So long as baby is doing well and comes out healthy, then it really is up to the intended parents what their preference is.
Mm-hmm. And then Jordan, after baby is born then, so baby has gone to one of those places that Alyssa just mentioned, then what are the choices that these new parents need to make from there? So choices on, I know there's potential shots and ointments and things like that. So what needs to happen from there?
So say baby's in the warmer. Parents didn't necessarily want to start with skin to skin. They'd rather let the nurses do their assessments and get everything over with, and then fully embrace baby once they're like cleaned up and everything's ready to go. A full recovery time for a baby is typically about 2 hours unless there is a high risk concern. Within that 2 hours, that's when intended parents and the nursing staff would be in communication on what medications baby is going to be given. This is where a conversation really should happen with your intended parents, whether that's from the surrogate themselves or your case coordinator informing you that that was their decision. Because if they're not at the delivery, you should not be signing off any kind of agreements on giving baby any kind of medication since it's not your baby. Mm-hmm. But medications to keep in mind would be the vitamin K, which is highly recommended for blood clotting purposes, especially if babies are in the NICU. Neonatologist providers are very pushy on vitamin K because if baby was if baby ended up having any kind of brain bleed, it's not something that they can stop because they don't have that clotting factor. They have erythromycin eye ointment, which is typically just, if we're going to be transparent, we're talking about labor and vaginas are not very clean. So it's more of just to keep infection out of the baby's eyes if that's a risk. And then the last one is the hepatitis B. This is the bigger, more controversial one, but a lot of different countries do this one differently and or have a different time frame for when they want to do it. The United States standard is typically doing it at delivery and then doing it again, I believe, 2 months later. So just making sure that you know what medications your intended parents are wanting and or if the intended parents are present, making sure they're signing off on which ones they are okay with giving, or if they have a plan for whatever ones they don't want, consulting with the provider on why and what their plan is for after, or just refusing as a whole. Either way, there's no wrong answer. It's your baby. You get to decide what that baby's going through. Another thing to really consider is the hospital that you're delivering in going to have 2 separate rooms for you? The reason that I feel like this is important to talk about when you get there is because even though I was totally fine with sharing a room if I needed, I was at the hospital that I was working at when I delivered, so I knew that our volume was high changing. We were in the middle of construction, so I know rooms were limited. And they were actually in overflow. We were taking med-surg rooms. So we ended up getting lucky enough to be in a room that had a double pull-out bed instead of a single flip bed. So we got to share the same room, but we still got to be separated, if that makes any sense. Like the same room, but they still had their own sleeping space for the both of them, which was great. I'm personally just one of those people that I love being involved. I love being a support person. And as a postpartum nurse, I want them to feel educated and supported. So I loved being present. It was hey, I'll take the next 2 hours. You guys take a nap and then I'll wake you up when it's time to wake baby up for a feed, or, kind of helping them also get that work-life balance of having a new baby. But you don't have to do that. Technically, they should be able to provide a separate room for the intended parents if that's what they so wish to have.
Mm-hmm. And I think that, so somebody had asked kind of when these things are discussed in the process. And like we had said, some of these decisions, I think, regarding specifically the delivery, I think could be brought up even right around when you're matching, especially if, for instance, the surrogate wants something very specific for delivery. I know we have surrogates who do choose to have a birthing center birth and things like that. So those types of things I think could be discussed even right up front. But some of these decisions about what happens, after delivery, I know I was having those conversations, I think starting about halfway through the pregnancy. And then it was kind of once we started getting into those more regular appointments with my OB. So is it around, I've been pregnant 3 times now and I still don't know, but when do you start going every month? You start going every month around week 24, 28?
It depends. Some providers are slightly different. So usually like week 28, they'll start having you come every 2 or 3 weeks. But typically around week 35, that's when they'll start having you come weekly. So everyone can be slightly different. It's usually like 4-week follow-ups until you hit your 3rd trimester, and then it's a little more frequent, and then it's definitely more frequent the last 4 weeks. So
I know, it's every other week that it starts to get a little bit more regular, because then the surrogates definitely going to those appointments. I know my intended parents were local, so they were coming to appointments with me. But for intended parents who are out of state or international, I know some folks get called in, and then it's a nice conversation to have with, I think, the provider who'll be delivering the baby, as well as then the surrogate, kind of all at the same time. So some of those more specific conversations I think are helpful. And I know on the last time that we chatted, one of you had mentioned, which was I think a fantastic point, is that the intended parents are going to need to pick a pediatrician as well. And so some of these questions about specifically care for baby after birth are great questions initially with the pediatrician, even though you've never like brought the baby to the pediatrician yet. They're still your baby's provider. And so being able to ask those questions of even the pediatrician, I think kind of towards the end in those last few weeks is really helpful. So thanks for that tidbit. That was like you a month ago coming up with that just stuck with me for sure. So I know we're going to be wrapping this up here in a minute, because again, we're out of time and there was so much to cover. But Jordan, are there additional kind of words of wisdom that you have, or tips and tricks that intended parents should consider as they're preparing for delivery? And then Alyssa, I'm going to come over to you with the same question.
I think when I consider like tips and tricks on the intended parent side is, if you plan on trying to schedule anything, especially international parents, purchase the insurance on your flights, because there is a high possibility that they're going to get changed. And there's nothing wrong with trying to plan, but just knowing that pregnancy is completely unpredictable. Labor is very unpredictable. Just being in close communication either with your surrogate or your case coordinator on what to anticipate is going to be a massive help for everything. And I feel like not everybody wants to be close with their surrogate, but even just having that like little bit of communication on like expectations for this situation is going to play a big factor in their role as well. Like, do I need to plan on catching the next flight and just boogie, or do I want to try to plan this out and be there 3 to 4 weeks before? Like, what is their realistic situation? Because not everybody can realistically take 4 weeks before the baby's here. Not everybody's in that situation. So just kind of maybe toying the idea of what's realistic for you, and then kind of seeing if that meets eye to eye with your surrogate or your case coordinator's opinion on how to be prepared.
This is fantastic. I love that advice. And again, I think it's, like you said, a very case-by-case basis. So talking with your surrogate, I think at the end of the day, communication is really just the biggest part of this. So Alyssa, would you agree? And what other advice would you give to intended parents?
Yeah, I think Jordan hit a lot of great points. I think the only other one that I would kind of add to bounce off of that is just be prepared for plan B if plan A doesn't work out, maybe even plan C. Just kind of having those backup conversations if this initial plan that we have doesn't work out, when it's reasonable. If this plan doesn't work out, this is what we want to do. And making sure that is talked about when it's appropriate. So having those backup plans, having those conversations, well, if we can't get this to work out, then this is going to be our backup. Having those conversations when you are in the matching process. So we often think, surrogates have a lot of preferences for the birthing process, but we don't want to forget that intended parents may as well. They may not. They may not have very many expectations going in, but there may be intended parents that have a lot of expectations. So any big items, I think, are great to mention upfront during matching. And then along the way, as we're getting closer to delivery, it's great to talk about maybe those smaller details that you may not think about in the beginning that wouldn't make or break your match, wouldn't make or break your experience, but that are great to talk about as you're preparing to deliver baby. Conversations about medications and when do you want me here in the delivery room. All of those conversations can wait if you want them to till closer to when baby's born. So I think just prioritizing kind of when you want to have those conversations and just be prepared for the unexpected.
Mm-hmm. And again, it sounds like it really comes down to conversations at the end of the day. So, and if you are not comfortable having that conversation, that's what our team is here for in a lot of ways, right? So we can help mediate those conversations. We can help you come up with ideas about how to broach some of these kind of tougher to have conversations. So please rely on our team. That's what we're here for if you need us. And, I think that goes a long way as well. So, and speaking of our team, again, I'm so grateful to have you both on staff here as our medical professionals and, helpers with all sorts of relationship building and communication. And I know that we value your input and your, professional experience here. So thank you both for coming on again and sharing more about delivery room expectations. I am confident we will have more topics in the future that will benefit from your wisdom and expertise. So thank you, and thanks everyone for watching. This will be uploaded to our website as well as our social media sites, so you can go back and watch it anytime. But we hope that you have a great night, and thank you for joining us.